Coming up today, a medical first in our region. A new transplant program is giving patients a second chance. And it all begins with one donor, one recipient, and a life-saving gift that's now reshaping liver care. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Every year, countless lives hang in the balance as patients wait for a liver transplant. Now there's new hope in our region. The University of Kansas Health System is offering living liver transplants. And today, we are introducing you to the first donor and recipient in the state of Kansas.
Every time I talk about it, I'm like, do you want to see my scar? It's kind of cool. I mean, it's not as cool as yours, but.
There are very few scars that make you feel proud, like you change for the better, and even save someone's life. Marina has that. She donated part of her liver to her friend Brandon.
It was like immediate change. I went from feeling bad all the time to feeling like Superman.
Here's how a living transplant works. A donor gives half of their healthy liver to a recipient. The liver grows back to normal size in both donor and recipient.
I paint a pretty realistic, and I don't pull any punches when I say how the post-op recovery is going to be and how big the incision is going to be and hospital stay and things like that.
Marina spent days in the hospital and took weeks off work. Her mother came from Brazil to help her recover, a sacrifice Brandon felt almost immediately.
I had walked in the hospital during recovery. I walked 2 miles, I think it was, 1 mile one day, the next day, just up walking around. I haven't done that in years.
Time rolls by from the hospital to a ball game. Look closely and you'll see Dr. King too. This would have been unthinkable for Brandon before his transplant.
I missed so much stuff with my kids and just everything. Going outside, I was always cold. I mean, your body goes through a lot of changes that people don't realize. Your liver affects a lot.
It's his new reality, living a full life.
Not everybody gets that opportunity for a gift that's going to save your life and change you.
Marina will tell you her life changed too.
You could save a life. I don't work in anything that I could save lives otherwise, different than doctors and many other professions. So saving a life is something I would never take for granted.
And we are so glad to have Marina and Brandon with us in studio this morning. Also sitting next to me is Dr. Tim Schmidt, Director of Transplantation here at the Health System. And we have across from me Dr. Clay King, transplant surgeon. And we're just so glad to have all of you joining us today, doing well, and just so glad to hear this story this morning. Brandon, I want to start with you. Tell us just how sick you were before this transplant. Just how was this affecting your daily life?
Yeah, I was pretty sick, especially in the beginning when I was first diagnosed. I couldn't do a lot. The ascites was really bad, and I got in here at KU with Dr. Taylor, and he got me on the right meds and on track, and then things started to kind of level out, but I couldn't do stuff. I couldn't be active, just attend certain events and things like that, so it was pretty bad.
And you just kind of feel bad, and is it kind of like Dr. Schmidt, you say, even with like kidney, you just kind of get used to feeling bad. You don't even really realize how bad you feel.
Yeah, with liver disease, it's worse because you actually have muscle wasting, fatigue, problems with your brain. Liver disease it just takes away all your energy, muscle, strength, heat, all that stuff.
It's horrible. Marina, tell us what would motivate someone like yourself to step forward and become a living donor like you did for your friend, Brandon.
I just thought if I'm healthy enough right now, at this point in my life, that I can do this, then why wouldn't I try? With the opportunity right in front of me, it was just served on a platter. And then I meet this guy, and it was the perfect stars aligning, and I have no way of saying no to that.
And when you said this guy, you were pointing to Dr. King.
Yes.
What did you mean by that?
Yeah, he just gave me a lot of confidence, and not knowing a lot about the process, he just gave me confidence, educated me. Him and Emily Kuzer were amazing, and I just thought I'm in the best hands. And I know this guy, and I saw what he went through in since 21, knowing his kids and his wife very well. I mean, I even commented to my parents, I would do this even if it wasn't for Brandon. If mine isn't a match for him and is a match for someone else, then it was meant to be to save someone else's life.
So even you would have done this for someone you didn't even know?
Yeah, I would.
Dr. King, what was it like when you met Marina?
Kind of like this. I mean, you're just a very warm personality to be around, and I think a lot of people think in that scenario they might want to be able to be a donor and try to save a life like that, but I think being realistic in myself, I mean, that would be a lot to ask of anybody, and so she never was putting on a front, though. Like, what you see is what you get with Marina, and I think that time has kind of continued to tell that. And so up front, it was just a very easy conversation, difficult topics to talk about because we have to talk about risks and all those things. But I think in terms of just kind of everybody being at ease and on the same page, it was more of a conversation than it was really like a clinic visit. So I think what people see in Marina is what you get.
Well, and you two are developing your own relationship because you're really helping her walk down that path as she makes this big decision. Dr. Schmidt, we have some video of a living liver transplant surgery. This was not Brandon's, but talk us through why this was the right time to launch a living liver transplant program here, because it's not just something you up and decide to do. There's a lot of moving parts and a lot of things you have to get in place to make sure it's the right time and that you have the right team in place and the right people with the right training.
Yeah, I mean, it goes back to 2020 when the allocation for liver changed and the MELD score for patients in our region went from low 20s to now 30. So you have to be really sick to get a list from the cadaveric list. So we found this group of patients that were in the middle of too sick to get a transplant, but not sick enough to get one, so they're in kind of a MELD purgatory, we call it. And we didn't have institutional support early on in our program to do this living donor because it takes a lot of manpower and a lot of resources. And we finally had Dr. King, and I knew that he had interest, talent, and the willingness to kind of go through it because it takes somebody to really dedicate a bunch of time to. And this guy was one of those guys who I saw had special gifts, talents, and wanted to do it. So we sent him off to India actually for 6 weeks, I believe. And I mean, it was a massive amount of training and knowledge that he learned, and I think it was the right guy at the right time.
Yeah, so we've got the right guy in place. We've got you, we've got the team. How does this program expand access to life-saving care for patients in the entire region and beyond?
I think knowledge, things like this will help people know that it's possible, and then outreach for patients who have liver disease to reach out to let them know that there is a possibility for them to have a living donor. It's not the most common in the area, but it's something that now is available for people.
Because gosh, where would somebody like Brandon have to go? And Marina, she would have to follow him out of state.
Right, there are some places like Pittsburgh has a big program, and there are other programs like in Texas, but that do a lot of living donor, but it's just not that common because it's a really risky operation and you have to have technical expertise to do it. And you know, it's a lot of resources and time.
So Dr. King, walk us through how a living liver transplant works medically. How does the liver regenerate itself?
I think the main thing is just Marina could tell you as well as I do. She underwent several days of a full battery of tests. Number one, for the liver, really just need to make sure that you have similar blood types. And then in terms of what makes Marina a candidate or not is really, does she have normal-ish anatomy or anatomy that allows us to leave her the half that she needs and to leave or give half to Brandon and be able to sew everything together. And that's really a pretty amazing process, and the 3D reconstructions and all the technology that we have available that helps us is really helpful in that. There's no gambling on these things. It's just, and that's what we talk about right up front is your portal vein or your hepatic anatomy is going to give you a yes or no much more than anybody in our committee can give you. Your liver is either transplantable or not halfway, and then if she has a healthy liver, really the rule we use is we have to leave her with 30% of her total liver volume. So we call that the liver remnant. So she's left with at least 30%. She actually, this is giving away a little of your details, but yeah, she had a little closer to 40%. Her left lobe was a little closer to 40%. So she actually had a little bit more remnant than normal, and also her right side was enough liver volume. We have to calculate Brandon's weight and make sure that there's going to be a certain ratio that we look for to say that, yeah, that's probably going to be enough liver mass for Brandon, and then enough liver mass for Marina. And then both sides, the second they get the blood flow, they're utilizing phosphorus and other things to be able to try to regenerate. And so she didn't build back a right lobe, and he didn't build up a left lobe, but his right lobe graft increased in size by probably at least 50%. And we know Marina's, we have a CT scan of Marina later down the road that her remnant doubled in size easily. So she really probably has about the same total liver volume. It's only one side of it.
Wow. Wow. Okay. I see why you have to have the right guy to do this.
Yeah, kidney transplant would be like an easy operation compared to liver. Liver is in the details. You got to get in the weeds really deeply, and I think the technical aspects of splitting a liver in half is way more than most people even can try.
Well, Brandon, what milestones stand out to you from your recovery?
Just being able to do things again, get outside. I like to be outside a lot. I like to go watch sports with my kids. I like to travel, exercise, just doing things like that people don't realize you take for granted a lot when you can't do it. So
just things that you were finally able to get back to doing.
Yep.
You were out of town this weekend and got to
Yep.
spend some holiday time with family, and
Yeah.
probably meant a lot to you, I bet.
Yeah, it does. Yep.
It does. Marina, what questions did you have before the surgery? Because I'm sure there's people watching going, I wonder if I could do that. I bet I would have a bunch of questions.
I just came in and I said, educate me, because I didn't know anything about the process. And I think they dumbed down their language a little bit for me to understand. And it was...
Yeah, you'd have to.
I remember Clay kept asking, do you not have any more questions? This is a pretty big surgery. What questions do you have? And I was like, I don't know what questions I can ask you. Tell me more about it. Mostly about after the surgery, if I would have any limitations, if my life would be the same, the risks and all that, but nothing too pressing.
Dr. King, you mentioned a couple of things, but what factors determine whether someone's eligible to donate part of their liver? What are you really looking at?
First off, number one, do they have any underlying liver disease? So they get like I talked about, a pretty extensive battery of tests, and then a real detailed history, because some things are very kind of fine, and a very subtle abnormality in labs may be, maybe if you ascertain, do you have any family history of liver disease or something like that? And so somebody may just kind of have the beginnings of some sort of organ dysfunction that we can't pick up very easily on the labs. And so it's all kind of just basically history, physical exam, laboratory work, and then the diagnostic studies, the imaging, and trying to piece together a safety profile. And if you're ever in the gray zone, that's a no-go. You don't put anybody at risk. And so all the things have to be pointing, yeah, this is going to be safe. Good volume of her liver, not a fatty liver. Liver labs look good. So you can tell the quality of her liver with some of the details that we find on imaging up front. And some people are not a donor possible as soon as you see those.
So what made Marina, just maybe on the outside, a good match for Brandon? What are you looking at? Is it male-female match? Is it size match? Is it blood match? What are some of those just obvious things that stand out when someone is looking for, because I would imagine Brandon's out, thinking, who would be a good match for me when I'm asking for a living
Yeah,
liver?
I think for one, young donors, people that have no real health history. We actually don't even get into the details. When Marina thinks, okay, or she knows Brandon and she says, well, maybe I want to be a donor, she calls in, and then our living donor nurse coordinator, Emily Kusser, that she mentioned, takes in the call. And we can't really ask medical questions until an independent living donor advocate, which is kind of a middle person between the transplant center and the potential donor, they have to ascertain, is she coerced to do this at all, or is she coming at her own, own reasoning for why she wants to donate? And so that is in place first and foremost. And so we meet her basically once we get the green light there, and we don't have a lot of labs that have resulted by the time we meet her, and so all these labs are happening at the time. So really the things are going to be, what are the glaring things? Somebody that doesn't look like a good surgical candidate for anything up front is probably not going to be good for donating half their liver. And so somebody that's young, healthy, Marina was playing volleyball all the time, so we're like, well, we want to get her back to volleyball. So the active lifestyle, not on many medications, healthy weight, all those kind of things that are obvious up front.
Dr. Schmidt, big picture, what role will living donation do to address organ shortages?
I mean, there's 16,000 people on a liver list, and I think only about 9,000 to 10,000 transplants a year. So there's always a shortage of organs, and we are seeing more and more people with liver disease just because of lifestyle, alcohol, and other problems. And so there's going to be a gap, and people keep getting sicker and sicker. You have to almost have a MELD score of 32, which is near death, to get a transplant on the cadaveric list. So there are a lot of people who are really sick who will never get a high MELD score, and that's where a living donor fits in, right in the middle on these people who have poor quality of life and don't have a high MELD score.
You're always so good at just talking about how important these donors are. You put whether it's a donor from the list, the families and the people that make those sacrifices, or somebody who steps forward. I mean, just how important are these people making?
Well, look at
these
Brandon. I mean, you
sacrifices?
saw the picture of him when he was sick, and now he went to Branson last week with his family.
Right.
I mean, that's why it's important. Life. People get to live quality of life, and then the donors have, I think, even more mental and health because they got to be that, and she gets to see this, and so that probably is really
and then
beneficial.
that story's out there, and then we get to share it, and then it kind of builds from there. Brandon, what does life look like if you compare from last year to just now? We just talk about of course your living life, but just kind of take a snapshot. Just what does life look like now compared to a year ago?
Yeah, I mean, it's great. A year ago at this time, I was still, a little bit still recovering, but I'm not like sick like not feeling good. So I feel good all the time now. A year ago, I wasn't feeling good a lot still, but now it's just, everything's back to normal, I think.
You were feeling good enough to get a tattoo.
Yeah.
Yeah. Okay, let's show it off. Show off the tat. Okay, can hold it out so our guys here, hold it up so they can see that, because that looks pretty. That's pretty detailed and pretty nice.
Yeah.
What did that mean to get that secured there on your arm, knowing that people are going to ask you about that? People probably ask you, what does that mean? What does that stand for? What do you tell them?
Yeah, well, I tell them exactly what it is, and I had it put there for that reason, so it stands out. You shake somebody's hand, it's there. It's a talking point for awareness, so that people can be aware, because people don't know about living donor. So it's new here at KU, and we hope to get other people involved.
How are you feeling a year out, Marina?
Amazing. I've felt like back to myself since probably January, a few months after the surgery. Went back to playing volleyball in January. And like Brandon, I don't have a tattoo yet. I think that's a great idea, but I do have a fanny pack that I wear all the time, and it's got the green ribbon and little liver, and everyone asks me what that is.
So you're raising your own awareness.
Yeah.
Good, good. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Dr. King, what's the process for getting on and staying on the transplant list?
I think for Brandon and patients that need a liver transplant, they look the same, whether you're doing living donor or deceased donor. And so obviously if Brandon would have been able to come up for a deceased donor liver and we never would have had to operate on Marina, that would have been the choice we made. However, he was stuck in an area where his quality of life, like Dr. Schmidt said, quality of life was poor. Like Brandon said, he didn't even feel like he was living day to day. He was like basically running on medications just to be able to stay at home instead of be at home or in the hospital. And so for the patients on the list, the patients that were already listed before we started this program, we've kind of tried to retroactively speak to them about, hey, this is a possibility. If you have somebody that you can bring forward, bring somebody forward. And if you want to come in for the education session, at least learn more about it, we have him come in for the education. And so that part of we have a a big list of people that need a liver transplant. And so going back and doing all that's important to make sure that they are aware of that. And then everybody that comes in as a new evaluation who needs to be on the transplant list, we address that up front so that they know that that's a possibility. And so I don't know if that answers your question exactly, but
It does.
Everybody has to be listed for transplant.
Marina, what advice would you give someone considering becoming a donor?
I would say, first and foremost, just call Emily, call the transplant department.
Ask questions, yeah.
Ask questions, just get evaluated, see if you would be a good candidate. And if you have that burning desire to help, like I do, that you want to help someone so badly, this is an amazing opportunity. If you're healthy enough, just call and go through the labs and the evaluation and see if you're a good candidate,
and I think
whether or not you know someone.
And I think it's a good point. We kind of talked about it, Dr. King. It's okay to ask questions, and maybe it isn't.
Yeah.
It isn't maybe the right thing, and it's okay though to ask those questions and find out that wait, maybe this isn't the right route for me. But it's okay to find that out.
Yeah. You get educated and you can educate others about the program.
And it's okay to walk away from that and find out that it's not right for you, but maybe it is, and that's even better, and that's okay. Brandon, what kind of lifestyle changes have you had to make?
I want to make sure that I eat right, exercise, stay healthy, just things that I know I need to do.
Yeah, Dr. King, what kind of things do you have to do to take care of a new liver?
Number one, first and foremost, is up front. You have a lot of visits back to getting labs, making sure that even though he's a match from a blood type, you got to be on medication so that his body doesn't recognize that that's still Marina's right lobe, although it's housed differently and he's taking well to it. But he has to maintain the medications for the rest of his life to make sure that he's got his anti-rejection medications, and then just the general health otherwise too. So staying healthy and making sure that he's got his blood pressure and all those other things that he's got to do anyway. But
what about for Marina?
Marina has a standardized follow-up that is required for all living donor programs, and so we actually doubled all those visits for the first year. So we see her every 3 months, and then now that she's having over a year, we're really required to kind of see her at the 18-month and 3-year period, but we're still doing it every 6 months. And so labs and making sure that things are going well there. Generally speaking, if she comes in and says she played 2 games of volleyball the night before, so she's a little bit sore that day, that's a pretty good indicator that the labs are going to be pretty good.
That's good. That's good. We like to see that. Like to hear that.
I think that actually happened.
Yeah, 100%. Yeah.
Real story, true story. Dr. Schmidt, what are the biggest barriers moving forward when it comes to like awareness, donor availability, resources? What and how do you hope those get addressed moving forward?
Things like this will help awareness, and then we have to educate each patient who could be a living donor that there is a possibility that they could reach out to try to find a donor. And so I think it just takes time, effort, and awareness. I think the barrier is just awareness mostly.
Sure. Brandon, there's going to be other people who sat where you sat waiting, not feeling well, feeling horrible. What message do you have for them as they wait for their Marina and wait for their call?
Yeah, just don't give up. Keep hanging there and just keep hope. Don't give up, and somebody will be there to help you in the end.
What's been the most meaningful part of this for you, Marina?
To see him like this, there's nothing more rewarding.
I bet. Dr. King, where do you hope to see the Living Liver Transplant program headed in the next 5 to 10 years?
I think it's just have outcomes like this. I appreciate being able to be on the show and spread awareness. I don't know if that's spreading it more than your tattoo is. I'm probably not going to get a tattoo, but we'll talk about this all the time. But I think it's just increasing the number. We want to have people like Brandon. We want to decrease those people waiting on the list that have a MELD score or their objective labs that say how sick they are. If they can't get a transplant from a deceased donor, then we need to try to work to get as many of those people transplanted as we can. And so I think the awareness is the big part, but aside from us talking about it, it's just showing these guys on screen and watching that video. I mean, it motivates us. It makes me want to go out and make sure that we have everybody call in for that kind of deal. And not everybody's going to be a candidate. It's just that we need to explore all options, and not every there's not a one size fits all for liver transplant, and so I think at least exploring the option and getting the information on why you're not a great candidate after a thorough workup is just what we have to do. And I think these guys are just champions for our entire program, and we couldn't have had a better two to start the program with.
Let's get to some questions from our viewers this morning. Jeremy wants to know, does that ability of the liver to regrow help with accepting the donor liver, like it adapts to the new body easier than other organ transplants?
I think it's just a matter of size and making sure first there's got to be enough volume to start with. The liver's going to grow no matter what, but if you put too small a liver in, it will never start up enough and not be able to grow. So you have to have enough to start with first, and I think that's really the main consideration when we consider size, is you have to have enough to start, and then it's going to get bigger.
Marcia says, Dr. King said that the donor doesn't generate a new lobe to replace the one removed from the recipient. Do both lobes of the liver do the same work? So the larger left lobe does the job of the donated right lobe?
Yeah, so the liver is just 8 independent functional units, 4 on the right and 4 on the left. The left side just happens to be usually somewhere between 30% and 40% of the total liver volume. And so for adult to adult living donor liver transplants, the right lobe is almost always used because generally speaking, the recipient, especially in the United States and in the Midwest, we have patients that aren't all that petite. We need to make sure we have volume. And so the other thing is when people are sick like Brandon, they have ascites, they have an extreme amount of blood flow through the portal venous system, or the system that is kind of unique to the liver, and you can overwhelm a smaller liver. That's what Dr. Schmidt was getting at there, is if you don't give enough liver and you have all this blood flow, then you have to figure out a way to decrease that blood flow into the liver, and then it gets into kind of more complex issues. And so the left lobe and the right lobe function exactly the same. Brandon gets the smaller side of the bile duct. Marina keeps the safe big part of the trunk of the tree, and really all the safety profile is always towards Marina, and then everything else is making sure that we can safely do it for Brandon too.
Question from Amy. Amy wants to know if there is an age limit for donating part of a liver.
That's a moving target. I think for us initially, because you have to show success earlier or your program's not going to work, and so initially we thought 50 would probably be our upper limit. We've since moved that to 55, and there are certain programs across the United States that are up to like 60 for potential donors. For us, it's an individual thing. We like we just said, it's not one size fits all. At some point, you have to probably put a cap on it, but I don't know really what that extent is yet. So I think we're willing to kind of assess each donor as they come.
Brandon, Melissa wants to know, how has the transplant changed your outlook on family and future experiences?
I think I'm more involved now with my family. So not everything's left with my wife to do everything with the family, and the future is just being normal again. So it's like nothing ever happened.
Dr. King, what's the big takeaway from our program today? What do you want people watching and listening to really know?
I think just you can see how these two feel about each other, and how much they've meant to us as a program. And I think the one thing that I asked on the first visit back to is 2 weeks after the donation is, would you do it again? Because if at the 2 week mark, when you're kind of at your lowest, that's when you're still dealing with pain, you're still not moving around well. If you still would say you would do it in that moment, then it's really something meaningful that we need to continue to do. And Marina said right away, absolutely, wouldn't even reconsider. And I think that in and of itself gives me, the confidence to continue to move forward, because it's the easy thing would be to not start a program. And so the support from Dr. Schmidt, from the health system, and to have this going is really big for our region, and it's important for our program. And I think just being able to have these opportunities and have champions for the program, it means everything.
Dr. Schmidt, what's the big takeaway?
Well, I think it's awareness. We want people to know that this can happen, and people can have hope with getting a transplant. There's so many people you might even know somebody who needs an organ transplant, whether it's a kidney or liver, and that people don't even know that this is an option. And so if you do know somebody, there is a way to help. And if you can't help them, at least you can let them know that there is options out there for a living donation.
Well, we do lots of kidney transplant stories, obviously living kidney stories, so it'll be exciting to continue to tell these stories with
Yeah,
your
liver
patients.
patients are sicker and just more debilitated.
Yeah.
And there's no dialysis for the liver, so there is no backup plan. We need the organs for people with liver disease.
That's a really good point. That's a really good point. Marina, what's the big takeaway from your story, you and Brandon's story?
Big takeaway is that my life is absolutely like it was before, and it has been since maybe 2-3 months after the surgery. So I would just say I'm very thankful that we had these two guys starting this program, and that anyone considering, we are in the best hands here. I came here a lot this past year, and now that it's been a little bit longer, I don't come as often, and I learned something new right now in the last 30 minutes. I learned from these two guys. So you're in the best hands here, so it's the right place to just go get evaluated and ask questions.
Well, your part of the story is really why we're doing the program, is to show that you can do this and be well and healthy and get back to life.
Yes.
So thank you for your gift.
Thank you.
Thank you for your gift. Brandon, what's the big takeaway today?
That you could just be yourself again. You know, as sick as I was, losing 50 pounds, and then getting back up to almost where I should be. So I feel great. And thanks to Marina and Dr. King and Dr. Schmidt. So,
Well, we're glad you're doing well.
yes.
And
Yeah, I
get
am
back
too.
to get some more tattoos and spend more time with family and travel and just get back after
Yep.
it. Thank you for
tattoo, it's advertisement.
advertisement. Okay, I like your thinking.
Yes.
I like your thinking. All right, thank you. And thanks to all of you for being with us today. Really appreciate it. And we will see you back here tomorrow when we share this. 1 in 26 people will experience seizures at some point in their lives caused by sudden bursts of abnormal activity in the brain. We explore the latest treatments and share the story of a patient who opted for surgery, revealing how his life has transformed 1 year after the procedure.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.